feel like your clinic was endangering health?
The owners of a Timonium clinic forced to close are keeping quiet, but the family of a woman who died after surgery at Monarch Med Spa is talking. Tonight, they're opening up to us an exclusive interview. ABC 2 News investigator Josie Sturman is here now with their plans to try to use this tragedy to close a loophole that could impact you. And this is a very emotional thing for this family.
Absolutely. Eula Witherspoon was an intensely private person. That's originally why her family didn't want to release her name or even talk about what happened. But after we found them by digging through state records, they decided the time was right to finally tell her story. When you dine out, an inspection lets you know the restaurant is safe. Same with your car, your daycare. The state looks at all these things to protect you and your family from harm. But sometimes we just assume things are getting a closer look.
Your average viewer would never dream that that's the case. I mean, they think you're delivering health care. You know, my barber needs to be certified. There's got to be some oversight.
Oversight in the operating room. We know hospitals have it. But in Maryland, some other places where surgery is done simply don't. What are they missing at this moment?
That's right. They don't get licensed. They don't get the inspections.
No state licenses, no state inspections, no state oversight for certain surgery centers and med spas in this state. You just assume they're safe.
You feel like you're living like the Wild Wild West. That's what those clinics are like.
In Maryland, med spas and plastic surgery clinics that don't bill insurance as ambulatory surgery centers are not overseen like hospitals, even though some of the same procedures are done. In fact, a legal loophole means the clinics have no state oversight at all. Some believe that's a fatal flaw in the system.
We suffered a tremendous loss. It's like a loss that is unbelievable loss.
Denise Witherspoon and her family talked exclusively with ABC 2 News investigators about the death of their sister Eula. Before now, you've never heard her name, but you know her story. 59-year-old Eula Witherspoon's family says she was one of 3 patients the State Department of Health and Mental Hygiene says got infected with an aggressive form of strep after procedures at Monarch Med Spa in Timonium. Eula's family says she died September 17th, battling an infection she got during liposuction.
I screamed. I know everybody in the ER heard me. I screamed to my mother. And I told my mom she couldn't have her.
But Eula, a longtime addiction nurse at Mercy Hospital and a surrogate mother to her 12 brothers and sisters, was gone.
Always smile, all her pictures.
Her life, filled with travel that took her around the world, was cut short following plastic surgery in a clinic her family assumed was just like a hospital. But a state order shows investigators sent into Monarch after Eula's death found probable deviations from standard infection control. Monarch was forced to close, and the state health department's release on the case contained a line that stunned the Witherspoon family, saying, quote, "Cosmetic surgery centers in Maryland are not currently subject to state licensure."
I was totally shocked.
Shocked to hear about Monarch, but ABC2 investigators found other cosmetic surgery centers across Maryland that could fit into this category. The doctors are licensed, regulated, and, if need be, punished. But the centers themselves are not.
Things that are done in an office now, we wouldn't have dreamed of doing 5 years ago in an office. And the regulations in some parts just haven't kept up with them.
Eula's death has forced the state to play catch-up.
That is a bit of a loophole, and that's a loophole that we think should be closed.
Maryland's Health Secretary Dr. Josh Sharfstein says the Monarch Med Spa case shines a light on a potential risk.
I don't want to hear about outbreaks where people are dying in the state of Maryland when it could have been prevented, and I think our job is to figure out ways to prevent those from happening in the future.
In October, Sharfstein's office asked for public comment on whether more oversight was needed. The Maryland Ambulatory Surgery Association said regulation of clinics shouldn't be tied to their billing practices. That's key, according to Sharfstein. He's asked lawmakers to make changes in this session so every plastic surgery center gets oversight. He also wants to give you more information, so when you search your doctor online, you'll find out whether they'll do your surgery in a place that's accredited.
Really learn the lessons of the tragedy here and try to make it safer for people in Maryland.
It's too late for Eula Witherspoon, though. Her family is now fighting to close this clinic loophole, looking for a state lawmaker to sponsor what they call Sister's Law.
Will we want this? No. We want our sister back. Totally. We need her. We are lost. She's our rock.
They cannot control the past, but now they find strength in being the foundation of Eula's future, ensuring she didn't die in vain.
We are the guardians of her legacy, And it's our job to make sure this type of thing doesn't happen to anyone else.
Those investigators from the state health department were first sent into Monarch 4 months ago, September 17th. And now the agency tells us a final investigative report is still being developed, Kelly, and they are working on that legislation. It's been drafted, but not yet introduced.
So what's Monarch have to say about all this?
At this point, Monarch is still closed, and their attorney tells us they can't really comment, but all they did say is they are cooperating with the state and that all Monarch employees who had any contact with the patients in Maryland were tested at state-designated labs and cleared. Now, keep in mind, a lawyer for the Witherspoon family tells us a civil lawsuit in this case is pending. And if you want to watch our entire investigation, just go to abc2news.com/undertheknife.
Great work.
Thanks so much.
Oh, thanks, Light.